Hey Vesper fam, it is Friday and it is time for Ask Dr. Drug Dealer. And on this week's episode, I decided that we should talk about face masks. Today I have 3 different types of masks I'm going to show you. We'll start with the most common. We have surgical masks, we have a KN95, N95 type of mask, and then we also have a homemade mask available. So what's the difference? Well, surgical masks are going to be the most common mask that you see. You've seen them at doctor's offices, dentist offices. They fit loose. They create the barrier between you and someone else, somebody else between you. Probably the most common mask by far. Then we have the medical grade KN95. These ones are tight fitting. They're designed to form a seal, and when you breathe, you see it collapse because it's actually filtering 95%. So a little side note, it's very important to know that if you have a respiratory, COPD, or asthma type of issue, these masks can be a little bit dangerous because it is filtering so much and it is a little bit difficult to breathe. Oh, also I must mention, if you're using a type of mask like this, it is recommended for you to not have any facial hair like me. I did shave this morning, but already all came back. I do apologize. So for the example, it wasn't good enough, but you can see, even with that, it is still creating that seal. Last, we have a homemade mask. You see these around everywhere. People are making them and they work just as fine. They're recommended for the general public. I will show you a little example of the filtration ability between all 3 types of masks. But as we're being told, it is important to have something is better than nothing. Yes, the virus is small, it could probably get through this and that, but having this face cover or any type of face cover will already help you versus not having one. First, I wanted to show you the filtration capacity between 3 of the masks. So first we're gonna put on the homemade mask. And what we're gonna do is the lighter test. So as you can see, I put it on, it's sealed. So we're gonna turn on this lighter, as you can see, and I'm gonna try to blow it out. See, it went right out. That's a homemade mask. Next, I'm gonna take the surgical mask. Surgical mask has a little bit more filtration. These do come in different versions. This is just a standard one. Put the mask on. Turn on the lighter. So I'm noticing a little bit of flicker, but I'm not able to blow it out. It's a little difficult. I'm sure if I tried, I'm not sure if I get winded first or the light's gonna go out. Last, let's take the KN95 mask. I can't even get that to blow out. So as you see the difference in the levels of filtration from basically the thinnest, a little bit thicker, to the thickest. So what's the best way to clean or disinfect the mask? Now, there's a lot of information out there and I cannot personally recommend a certain type or way to do it. There are lots of different studies, but those are kind of changing every day right now. But I have seen probably the most common is having between 4 and 7 masks and then rotating your mask every day. So a lot of people I've seen take like a Tupperware and they put their name on it. So after they had the mask on, because you got to treat this outside mask as it being dirty. Every time you handle your mask, you have to use some hand sanitizer, wash your hands, is going to be the most important. So I've seen people take the mask and then put the mask inside a Tupperware like that, seal it up, and then put it aside, take the next mask, and then they're gonna rotate, so every day. So by the time you get back to the original mask, you're hoping that the virus or bacteria or whatever have reached it at that point has been killed off. That's one method. There are methods I've seen of heating them. That could be a little bit dangerous. If you have access to an autoclave, that's a possibility. But what I've seen the most is don't spray anything because that can damage the filtration. Now these are disposable, but on these fancier masks, like you don't want to spray anything on there because this actually can damage the filtration capacity. When it comes to these homemade masks, I'm pretty sure you could just throw these in the washing machine because they're made out of fabric and those are the easiest ones to take care of. So in the end, my recommendation is that any type of face covering is going to be better than no face covering. Yes, there are better masks than others, but as we've heard is that you need something. So with that, I hope that was some information. If I can answer any more, make sure to like, share, tag, and follow us. Reach out to me, and we'll be back next week with Ask Dr. Drug Dealer.